GOLD participants from around the world. I'm Kristen Schwartz, licensed midwife and MC for GOLD Learning, and today I'm chatting with Illysa Foster about her upcoming presentation titled Ethical Practice, Boundaries, Scope, and Competency. I'm so excited to have you with us here today, Illysa. Welcome.
Thank you, Kristen. I'm happy to be here.
So, Lisa, tell us a little bit about yourself and how this became a topic of interest for you, and tell us a little bit about your professional journey.
Well, when I was training to become a midwife in the early 2000s, I was looking for guidelines to ethical behavior, and I had a lot of difficulty finding them. And I became very interested in looking at interdisciplinary applied ethics. So I searched internationally for guidelines for midwives, nurses, and mental health care providers. And I was, through this journey, able to start thinking about how to apply ethical principles to midwifery by use of other disciplines and their work in this area. So I decided to write a book that was accessible for practicing midwives as well as midwives in training. And that book became kind of the standard in the US for ethical midwifery training, I guess midwifery training in the area of ethics. And I became involved in assisting NARM with some of their policies around informed disclosure and ethical practice, and was invited to present at various conferences around the country. And it gave me I got to have an insider view because I was also a practicing midwife. So being both a writer and a participant in this field while thinking about ethics really helped me to uh, apply the more abstract principles of ethics to a midwifery care setting. So I kind of brought together a midwifery model of care with applied professional ethics from other disciplines. And as complex as that sounds, it wasn't as challenging because midwifery model of care was kind of the guiding force beneath it. Relationships between midwives and their clients was always the center that I would go back to, and I would ask myself how to apply ethical principles to practice.
Sounds really fascinating. So you kind of brought the theory of ethics really into the field of midwifery and applied it into, everyday midwifery life, so to speak. So while doing so and while writing all these the books and doing the research, what barriers have you encountered when shining light on that topic? And maybe also, have you noticed anything or seen anything that surprised you with regards to this topic?
Well, I was delighted that midwives internationally were excited about my writing. And my co-author, by the way, is my husband. He's a licensed psychologist who specializes in ethics. So I had his support and his views combined with my own in reaching a broader audience. So I was very delighted that internationally this was being embraced, and the ACNM leaders in ethics were embracing this, even though I was a CPM. And I found it more difficult, interestingly enough, when it came down to local turf. How do you then, as a midwife practicing, interface with your own community to raise the bar ethically? And that was where it was most challenging. So, starting a peer review group locally that actually was reflecting NARM standards and then when I would visit other communities, they were having those same kinds of challenges. This is all great in theory, and we enjoy thinking about doing ethics, but how do we actually apply it to the context in which we work? And so I had created this ecological model of ethical thinking. And that was kind of the perfect way to translate these to different cultural contexts, different community contexts, because there's no overarching, this is the right way to do it, this is the wrong way. It's like, how do you do it within uh, your community, within your practice, became the kind of defining standard. And so it doesn't mean that we're moral relativists, but it does mean that when you hit those boundaries or those barriers in your own community, you can think about, well, we may not do informed choice in our community in this way, but how can we use guidelines around informed choice to inform our practice locally around giving our clients the information they need to make informed decisions about their care?
Yeah, that sounds fascinating. So as you're saying, there's no um, really one solution that works for all, but you're kind of inviting local communities to find their own way of applying ethical practice into their practice and into their community. So what do you hope our delegates will take away from your presentation?
Well, I think that the best thing that participants could take with them is the concept that we're always doing ethics when we're providing care for someone. We need to be consistently conscious of how we're practicing ethics in those relationships with clients, with colleagues, and with our intersection with the community. And if that part is brought up to consciousness, and in this presentation around boundaries, scope, and competency, then we're playing more of an active role as ethical practitioners than if we keep all of that kind of in the back of our mind, dusty, and we only bring it out when we're doing our ethical training. So I would say that would be my goal, is that people start becoming aware of doing ethics on a daily basis in their work.
Sounds absolutely wonderful, to being aware of ethical practice in their day-to-day work. That sounds like a wonderful takeaway on this. And so, Lisa, I would like to thank you for chatting with me today. It's been an absolute pleasure.
Oh, you're welcome. Thank you for having me.
You're welcome. And Lisa's presentation, Ethical Practice, Boundaries, Scope, and Competency, will be live during our 2017 GOLD Midwifery Online Conference. And it will be live on February 15 at 20 UTC. And to find out more about this presentation and when it be held in your time zone and about our other presentations, please visit www.goldmidwifery.com. Thank you so much for listening today. Bye-bye for now.